Good afternoon, we're Health Tutor. The problem that we're trying to address is that there's a large amount of the population that have a limited understanding about their health and their health issues. So how we're going to fix this, we're going to prescribe health education. I'm going to show you how that will work. So the patient will have this application on their phone. This is the doctor view. So the doctor will prescribe modules that they think will be useful for the patient to know. They'll generate this QR code. The patient will then take their mobile device, scan that QR code, and have those modules that the doctor's prescribed added to their account. They can then go through these modules, do the reading, have the videos, have the audio, so there's multiple different ways of getting that information. There'll be quizzes to check that they've had understanding of this. This is something that's missed a lot if you just give them a leaflet. You don't know if they've actually understood what you've given them. So they can do these quizzes, they can check their progress. For different modules, they'll say if it's in progress, if they've completed it and got 100%. There's a bit of a gamification element here as well, where there'll be badges for the achievements. If they've done a certain number of modules, they've done a certain amount of percentage for each one. This is the demo. So here we can see the modules that the patients already have. They can remove them if they want, they can cross them off. They can go into all the modules here and browse them themselves. Maybe they see something that they think they're missing out on, they can add that module. Or they can just scan the prescription at the top, which is the modules that the doctor thinks they would benefit. So they have the option of browsing or adding the ones that the doctor clinician. And then we've got the achievements tag here where you can see once they've completed these modules, they'll earn those. So what's the impact of this? Go back to the slides. So the main thing we're trying to target is to improve health literacy. This is something that estimated cost between 2.4 and 3.4 billion pounds a year. Part of this is due to readmissions to hospital from people that haven't fully understood the advice they've been given. This is partly medication non-adherence, because they don't really understand why they're taking the medicine, so why would they do it? There's increased quality of life from better health literacy, and hopefully reduced mortality as well. Thank you very much. If you want to have a go on that app, the QR code's there. You can prescribe things to each other and see how you get on. Thank you very much.
Well done. Let's start with the questions. Right.
A great presentation. Who or how creates this, the information which will be provided, and how are you going to ensure that it is actually addressing all of your inclusivity desires?
So who creates it in the first instance? So this was just set up by the administrator, the modules that you saw there. One feature we'd like to add is that the clinicians can add their own information. So everyone's got like a favourite source for giving patients the information, and whether that's from the British Heart Foundation, from the NHS website itself. They'll be able to make these modules based on that information, generate a quiz based on that, and then prescribe that as they see fit. There'll be an element of the clinician checking that the materials that they're using meet the guidelines, and that I think it's 7 to 9 years old reading level, that they include videos for people that are below that level. And another one that we want to do is for the actual quiz itself to be more accessible, so you don't actually have to read the questions to be able to answer them. So videos, pictures, things like that. Does that answer your questions or anything? Thank you.
Hi, how are you going to persuade patients to do it?
That's an excellent question. So I've mostly worked in the inpatient setting. I'm an F2 doctor. The opportunity that I've identified is when they're in hospital, they're laid in bed, they're very bored, they're maximally motivated to try and change their health because they've ended up in hospital for a particular reason. So that's one of the windows. The other one is when they're sort of attending their primary care appointments, if they've got a problem, instead of, this would be replacing that leaflet that you're giving them. Hopefully the motivation is that they can keep track, they can see they're making progress, and it's more motivating than just a leaflet. Thank you.
Can people use it outside their interaction with the doctor? So if you know you have a heart issue or a diabetes issue, you don't need the doctor to tell you, but you could still use it to go and get the information you need?
Yeah, absolutely. That's why we thought it would be a good idea to include that you can just browse all the available modules so that you can choose ones that if you think you've got a gap in your knowledge, and you can choose that. I don't think I covered it, but there was different levels. There's beginner, intermediate, advanced modules. So if you start off with a beginner one, you could be like, okay, maybe I want a little bit more. I'll choose an intermediate one next.
Languages, different languages. Is this possible so that people could have it in their own mother tongue?
I think so. I think a lot of what we imagine the sources for this information would be, so British Heart Foundation, NHS, all these things. They tend to have multiple languages that they produce these things in, some more languages than others, but I think so. Thank you.
And there we go. Well done.